Ajay ji, if we could start with a brief background and also a quick understanding on what motivated you to work in the field of road safety with some examples.
Sure, Nishita. So, at United Way Mumbai, disaster response and community-based disaster preparedness have been one of the critical focal areas for us to work under right from our inception. And when we look at disasters, what are disaster events? Events that overwhelm the existing resources or stakeholders' capacities. And we, in the process, we came across the accident reports of India, where we saw overwhelming number of over and half lakh people being killed on an average on an annual basis on Indian roads. And we realized this calls for a disaster. This does qualify as one of the calamities, man-made though, that requires concerted efforts to work on. And our first encounter was with the set of Kalipiri drivers of Mumbai, where before we even began to work on, we realized one of the gaps was that timely medical care or timely emergency response available during road traffic crashes. And we thought Kalipili taxi drivers have fairly wider presence on the way, especially. And we floated a baseline assessment, a baseline survey with these taxi drivers, seeking firstly if they've witnessed such accidents ever in person or they witnessed somebody else meeting with an accident. And secondly, if they would volunteer to get trained as bystander care provider. And this study formed our need for, or it established the need to work in this field. The first intervention we thought of was to train people in first response during to the crash victims. However, besides that, we then also started working on the other elements of road safety.
That is wonderful. And thank you for bringing out the aspect of research and the need that was conducted. That brings out the very important factor of the project design being data driven and need driven. Thank you for bringing that out. And that leads me to also understanding that there are various initiatives that United Way Mumbai took up after that need that was established. If you could give examples or walk us through what those uh, various initiatives are and how do you measure impact for those initiatives?
Certainly, Nishita, and very rightly, as you pointed, data driven or evidence based interventions is key to even the strategies that United Way Mumbai adopts. This is what we called social impact done right.
Right.
And just riding on or building up on the data that we got as a result of this study, we also floated a study with the youth and two-wheeler
Mhm,
riders because
mhm,
one of the startling statistics in all our annual road accident statistic reports show that sizable number of people killed on roads are from the age group of 18 to 35,
mhm,
the most productive age group.
mhm,
And for a country that claims to be the youngest populous country in the world, and this population being killed in such a preventable cause. Secondly, they were all two-wheeler riders.
right.
So again, 38% of people killed on road are two-wheeler riders. So such a
Mhm,
fatal combination, youth and two-wheeler riding. So we floated a baseline study reaching out to college youth, reaching out to
mhm,
youth working on wheels. This includes people working for delivery, etc. And then young professionals who use two-wheeler to commute to work. And
mhm,
with this, we identified areas that make them nervous while riding, areas that prevent them from using safety gear, areas that lack in their learning or skills of riding a two-wheeler. Basis this, we designed an intervention. We
Mhm.
created a thorough training module on safe two-wheeler riding.
Mhm.
We did not want to float out the training module without even testing its authenticity. So we reached
Mhm.
out to the Office of Joint Commissioner of Police Traffic in Mumbai and to the Motor Vehicle Department, the Transport Commissioner's Office.
Sure.
Both these offices put their expert officers to go the content. They gave their inputs to this. We conducted a small stakeholder consultation with expert bikers, with youth or youth leaders or NSS representatives from the University of Mumbai, so that we wanted to ensure all elements of working on this problem. The problem is not a single fault problem. Two-wheel safety is the core issue, but we are
Yes.
dealing with youth. So how do we deal with them in an interesting, engaging manner? This is
Ji.
how the training module was finalized. And then we rolled
Mhm.
out a program in collaboration with the University of Mumbai, the National
Mhm.
Service Scheme Unit, NSS, SNDT University. These were our first encounter with say road safety intervention, where we would conduct a 5 hour long training in a college. This was
Mhm.
also new to colleges, that colleges are often open to extracurricular activities,
Ji.
but those activities don't entertain more than an hour. And we told them this is not a simple aspect. It's a
Mhm.
technical, fairly technical aspect that we wish to educate your youth in.
Mhm.
Therefore, it has to be
Mhm.
long enough. We made it an interesting module. So it was a 2.5 hour long classroom session using power packed multimedia session. Secondly, our trainers would carry a two-wheeler and often an icon for the youth. So it will be a super bike that attracts people's attention. Yet the trainer will tell them that I don't ride this bike without wearing these necessary safety gears. Now we need to feel these gears, see these gears, what is the role? And it's not just helmet, but all other riding safety gears. And then thirdly, we introduced a two-wheeler simulator because we also wanted to help the participants assess their own riding skills. Apparently, the license issuance system today, it assesses very limited aspects of two-wheeler riding. It assesses if you can ride the bike, you can balance on it, and that's about it. It's done in a very controlled environment. So the two-wheeler simulator provides us an opportunity to ensure safety, yet assess their riding skills on a road. So this was the entire program that we worked on. Eventually, we realized that it wasn't enough to work with the college youth. Well, they are the aspirant two-wheeler riders or already two-wheeler riders. But we also realized that it was important for us to work with the government machinery. And we extended this program to the motor vehicle department's regional transport offices. This is where people have to come for license application. And we thought this was the right time to intervene. We collaborated with the RTOs, and we have our teams stationed in some of these RTOs where all the license two-wheeler have to go through this training mandatorily as part of the license issuance process. So that's how we've been working on this aspect. In order to assess the impact
Ji.
of this program, we
Ji.
have a few aspects because it's again, it can't be just a one-time educational that we and forget about the aspects taught. So one is, of course, we do a pre-training test and a post-training test, a knowledge
Ji.
assessment, which
Ji.
gives us at the end of the session a fairly measurable knowledge gain score that tells us what new information has learned during the session. But in addition to this, we also went ahead and encouraged the trained college youth to form road safety clubs in their colleges. And these road safety clubs had a mandate of organizing educational activities on the theme of two-wheeler safety. We would give them the freedom to choose the theme. Is it helmet? speed? Is it drunken riding? Is it what is it that you would like to cover? And we would brainstorm, work with the youth to design those interventions, whether it is a street play, whether it is a poster exhibition, whether it is a drive in partnership with the local traffic police being conducted at a traffic joint, where you stop the defaulter two-wheeler riders and get the youth to counsel them. So these are the ways in which the youth would continue their engagement on the topic. One, this definitely gives a snowball effect to the program. But the most important outcome of this was that youth did not limit their engagement with the topic of two-wheeler safety to those 5 hours. They continue to work on the same topic now, preach their peers. This ensures reinforcement of the message, at least on their young minds. So that's how we've been working on assessing the behavior of this. We also, as part of this project, where we had conducted a baseline with the youth two-wheeler riders, towards the end of 2 years of implementation of this program, we also conducted a impact assessment or an inline assessment by engaging a third party, a donor. They engaged a third party to conduct this study, and was mainly into assess recall of the messages given, behavior change, voluntarily claimed, of course, by the participants. And we saw 70% retention among the participants. So this is the way we've been assessing the impact of the.
Thank you and congratulations. A 70% retention and recall rate on the modules, 5 hour intensive instead of a touch and go of otherwise what colleges are used to of 1 hour. You took up the challenge of having 5 hours intensive, and the result is measurable in terms of 70% recall value and sustainability in the forms of youth clubs. So, congratulations on setting also an example of how sustainability and engagement can go hand in hand for an initiative. Now, I would like to move
Thank you, Nishit.
ahead and bring out the difference before COVID era and after COVID era, because we see that the lives are not the same. And I'm sure that has been an impact also in your initiatives, including the road safety. So, what changed and what challenges came up during and after COVID, and how did you tackle them?
Very interesting question, Nishita. And like all others, we too faced the challenges caused by COVID lockdown imposed restrictions. These interventions required very close engagement with the participants whereby we were able to conduct those physical training sessions. And suddenly we had to learn the virtual ways of doing it. This forced our teams, firstly for initial few weeks, spent well, the team members were all caught up in their own houses, were not able to step out. We used this time to develop the virtual training module. And since there was limited engagement possible, different concept. For example, if we cannot now do the demo bike in person, but we can definitely create a video with our trainer doing a demonstration on a bike. And such videos were created, short videos for education. And then we sprung into action to conduct these sessions in a virtual mode. And again, in a way, we also saw this disaster as we see opportunities in disasters to learn new things, new strategies. We realized that the virtual mode of implementation had no boundaries, had no geographic boundaries. We were able to take the program beyond of our city, beyond the state. And with that, of course, now our activities have come back to physical mode because things have come back to complete normalcy now. But our presence now for all our road safety intervention is over 14 different cities of India. Uh, 8 states across India where we are conducting different set of interventions. And these interventions are on the lines of 4 E's of road safety. Globally, they consider there are 4 E's required to address the issue of road safety: education, enforcement, engineering, and emergency response. And all our interventions are these. So this two-wheeler safety intervention I mentioned is part of education. We work with school children. So with two-wheeler safety, we must have covered 70,000 youth across the country till date. And we work with 9 different RTO offices across multiple states. Children to train them in pedestrian safety and cycling safety. And because among the children, road traffic crash is cause number one globally for death. And this is why we work with school children, part of education. We are trained to 72,000 in this. Now, the second E of enforcement, this is where we have to help the police system in enforcing different road safety measures. So we've been working with the traffic police in Mumbai, the motor vehicle department of Maharashtra, where we conducted a speed management program, and we identified select accident prone spots, conducted a study by engaging IIT Bombay to understand what are the causal factors of overspeeding at these spots and what are the required measures to be taken up for implementation so the motorists will slow down at these spots. So this is we've come up with a report. The report has been accepted by the motor vehicle department, the traffic police joint commissioner, and they are now working to implement those measures on spots. The report also paves way for formation of a speed management policy for the entire state now. So this is how enforcement is working. We've done road safety audits of over 33 accident prone spots across India. This works on the issue of engineering. If we had right measures or right interventions done at such accident prone spots, engineering interventions, the accident rate definitely will reduce at these accident prone spots. So that's another element where we work on engineering improvement. And emergency response is to train community volunteers, police, commercial vehicle drivers as bystander care providers. Because again, 50% deaths are caused due to treatable injuries. So these, if they get timely response, those deaths can be prevented. This is how we are working with training such people. So this is how we cover all the 4 E's. We continue to work on this. COVID, most of this was done virtually, and now post-COVID, we've come back to physical sessions.
Fantastic. And thank you for bringing out the 4 E's: education, enforcement, engineering, and emergency response. Especially how it covers the entire cycle of prevention to cure, and faster response of the cure. So the entire cycle is covered. So thank you for that. And I sincerely want to also thank for emergency response, for bystanders being an important role, because sometimes we miss out on responding with the sheer fear of seeing the sight. And rather than being supportive, we are actually being uh, counterproductive to the situation by not responding. So, thank you.
And
My
with this bystander care
Yeah,
provider program, if I may just add an element,
yes,
this is
please.
exactly what we are trying to address.
Mhm.
Very frankly, we don't claim to create first aid providers.
Sure.
We don't train them as first aiders. That's the job of a para
Medics.
or a medical professional. But as a common individual, we still have a great role to play, which is don't pass by, don't
Yes.
ignore, be present, be aware of what are those key do's what are those don'ts that you don't cause an additional injury. Know how to mobilize an ambulance. There is a basic protocol that you should follow so that timely mobilization of a right type of an ambulance can be ensured. Thirdly, while I'm talking about this, that comes the first fear of law. People often feel that you may get harassed by the police, by the hospitals if you intervene. So why get into it? And we have the Good Samaritans Act in our country. So this Good Samaritans Act, what are your rights? How
Mhm.
you cannot be harassed by the police, the hospital. And this we get the local police officials to explain this to the participants.
Wow.
The moment an authority explains this, there is more sanctity to this. We get an ambulance doctor, 108 ambulance we have in
Gee.
Maharashtra, we get them to demonstrate, show to these participants what is this ambulance like. And the doctor explains what is the protocol you should follow. Because it doesn't mean that you simply call on the ambulance number helpline and you leave from the location. Is the location, you don't wait till the ambulance reaches. If you don't do that, you're delaying the ambulance from reaching to the spot.
Sure.
So such basic information is good enough for people to be encouraged. And how do we assess the impact of this training? At certain intervals of 4 to 6 months in that geography where we conduct these trainings, we keep in touch with the people trained to make notes of incidents where they may have responded. And
Hmm.
at an interval of, say, 4 to 6 months, we would organize a get together of these trained participants. And we would recognize or felicitate the ones who may have responded to incidents.
Fantastic.
So we call them the Jivan Doots, the
Gee.
ambassadors of life.
Gee.
And by this way, it allows us to measure the success, that how
Right.
many people were able to retain the knowledge gained and are able to use that knowledge that they've learned during the training to help to save lives. Yeah.
Thank you. And thank you for elaborating on this program. I think it's important because I personally sometimes see that there is so much that a common person can do if we just remove the fear of getting on with it. So thank you, and the fear of law and fear of medical responders. Addressing that, I think, is a very important factor for Indian citizens. So thank you. We are at the tail end of our interaction, but I would really love to know how do you see these initiatives panning out in the next 5 years? And what would be one aspiration in the next 5 years that you would see these projects reaching?
Very right question, Nishita. With global attention getting focused around road traffic crashes or road safety as a major global public health issue, and India, unfortunately, leading when it comes to the statistics of road traffic crashes across across in comparison with 99 different countries. India has a very strong role to play and to make a dent. The Ministry of Road Transport and Highways, they have taken a very uh, aspirational, very serious target to reduce these road traffic crashes by half by 2030. And this cannot happen without multi-stakeholder partnership collaborations. We are seeing a lot of companies considering road safety as one of their CSR priority areas. Of course, Schedule 7 of CSR also identifies road safety as one of the activities eligible. And these set of companies are not limited to automotives or companies working for manufacturing tires. Companies across the spectrums are finding this as a very relevant intervention to work on. And over the next 5 years, we must be able to make very concerted efforts. Education, we must continue, of course, but the most important areas of intervention for us are going to be enhanced enforcement, which is directly controlled by the government administration. However, we have a role, like we provided evidence to the local traffic police and motor vehicle department for speed enforcement. So such supports can be given by the private sector. Engineering interventions, doing these road safety audits, providing measures required for improving the situation there. And thirdly, the emergency response care. Each and every citizen in our country must be trained with, firstly, their own knowledge on their own rights and safeguards available by the law. And secondly, do's and don'ts. How do you respond? How do you ensure minimum damage or timely responses given to the victims of road traffic crashes? The other thing I just want to highlight that while we work concerted efforts, we must also have a very different perception towards the whole issue of road safety. From it being limited to the issue of traffic police or RTO to look after, it starts with each one of us. And if each one of us can be those responsible road users, whether I am a pedestrian, whether I'm a cyclist, whether I'm a two-wheeler rider or a four-wheeler driver, if we take those efforts to learn the skills required, get the information required about rules of the road, rules, signs, and behave responsibly on the road, I think that job will be easier for even the authorities to. Authorities find it difficult to carry out concerted enforcement campaigns. We've seen the amount of resistance faced by our state for helmet enforcement in the recent past. And this is where multiple stakeholders need to come forward, support. Corporates need to consider road safety as the priority for their CSR. And this could be even to improve the situation in their neighborhood, in the neighborhood of their plants, eliminate accident prone spots from their neighborhoods, or to work with youth in their neighborhood, work with women in their neighborhood on these different lines. I think with that, we should be able to really support the mission of the Ministry of Road Transport and Highways of halving traffic crash deaths by 2030. It's a very aspirational, very strong, yeah, very steep target. And but multiple staying together, hopefully this should be achievable for us.
Thank you. I especially am going to take back the point where you highlighted it is not just the work of authorities or or even corporates to some extent. Of course, you highlighted that corporates can take up that nudging factor of doing it as a CSR. But I especially will take back how each individual, whether it be pedestrian or cyclist, our role as individuals on the road, where we stop sharing on memes and Instagram that, okay, in India, you definitely have to look two ways in a one-way lane. And that being a joke, it should be a responsibility that this joke needs to be changed. And that can happen, like you said, by multi-stakeholder involvement and taking it up as a priority to achieve the steep targets that our authorities have also taken.
Right.
It does bring me to a conclusion of our interaction. Ajayji, any last remarks from you that have not come out in my questions that you would like to highlight before I close?
No, I think I've covered it well enough. I think the
Perfect.
multi-stakeholder responsibility is what the underlying factor to conclude our session.
Perfect. Perfect. Thank you, Ajayji.